Hi, guys. So, a question that we get asked on a weekly basis is why do I need this filling replaced? And it usually comes with, well, it's not hurting. Do I really need it replaced? Let's think about this. How often do we get the tires in a car changed? Every 5 years? Even though we don't realize it, our fillings go through everyday wear and tear, not only from the food that we drink, but from things like clenching, grinding, biting our nails, chewing ice. As a result, the fillings start chipping, crack, sometimes they even fall out. And what happens is that the seal between the tooth and the filling breaks, and bacteria starts getting into the tooth. And when this happens, a cavity starts to form underneath of it. So once we see that that seal is broken, we recommend for you guys to have them replaced before you start getting any sensitivity or pain, and in some severe cases, even a root canal. So I hope this little video was insightful. You guys have any other questions, feel free to give us a call at the office and set up a consult, or you can just send us a direct message and we will try to answer them for you.